Let's talk about psychosis and its connection to BPD. So, BPD can involve psychotic symptoms, though it's not a primary psychotic disorder like schizophrenia, for example. And although BPD is characterized by emotional dysregulation and unstable relationships, it also can include experiences such as hallucinations, paranoia, delusions, particularly during stressful periods. And these symptoms, while similar to psychotic disorders, often differ in nature, duration, and context. So, some key differences and similarities: the prevalence. So, psychotic symptoms are relatively common in BPD. Studies suggest that a significant percentage of individuals with BPD experience them, as high as 94%. I'm included in that statistic, unfortunately. The nature of symptoms. So, the psychotic symptoms in BPD include the hallucinations, paranoia, delusions, and dissociative experiences. However, these symptoms are often transient and linked to stressful situations or interpersonal conflict, which also is a differentiator between schizophrenia. And distinguishing BPD psychosis from psychotic disorders such as schizophrenia, schizophrenia is characterized by more persistent and pervasive psychotic symptoms, often with a different presentation. For example, individuals with schizophrenia may experience negative symptoms like flattened affect and disorganized thinking, which are less common in BPD. And the relationship to trauma is that childhood trauma is often implicated in the development of both BPD and psychotic symptoms, including the severity and frequency of the psychotic experiences. The treatment for BPD with psychotic symptoms involves a combination of psychotherapy like DBT and medication, including antipsychotics in some cases. BPD does not turn into schizophrenia or vice versa, and individuals can experience both conditions simultaneously. The presence of psychotic symptoms in BPD can significantly impact the individual's functioning, relationships, and overall prognosis. While BPD is not a primary psychotic disorder, it can involve psychotic symptoms, particularly in response to stress. Let's talk about some signs of BPD psychosis. One symptom that can occur as part of the illness of BPD is psychosis. This symptom is mainly characterized by hallucinations. The most common type of hallucination is auditory verbal hallucinations, which occur in 29 to 50% of patients. Sort of hallucination can happen frequently and cause a great deal of distress for the individual experiencing it, who perceives the voices as controlling them and evil in nature. They usually do not recognize that these are hallucinations, but instead think they are really happening. So, some signs to look out for BPD psychosis. So, someone with BPD psychosis will experience the auditory verbal hallucinations that are critical in nature and often encourage the person to act in self destructive ways. Other signs can help happen that loved ones can look out for to help them understand when someone experiences psychosis. So, some common BPD psychosis symptoms include visual hallucinations, strange or unpleasant tastes, smells and aromas that aren't actually present, tactile hallucinations, so feeling someone or something touching a person's skin, thought blocking, the inability to finish a thought or sentence, dissociation, delusions, feeling their thoughts or actions are being controlled by outside forces. There are quite a bit of dangers with psychosis, and someone who has episodes of BPD psychosis can put themselves in danger. For example, someone who's hearing voices telling them to do things and cannot tell that what they're hearing is not real. They may follow the orders they hear, even if they can cause harm to themselves or others. And someone who does not receive help or treatment for their BPD psychosis can end up with permanent damage to their brain structure. Can BPD cause psychosis? While certain risk factors may cause psychotic symptoms in people with BPD, but there's limited research on the link between psychosis and BPD. Experts believe that psychosis can be triggered by extreme stress and trauma. And as someone diagnosed with BPD and PTSD, this is 100% true. And I believe that there needs to be a lot more research done on how all of these connect and relate to psychosis and experiencing psychotic symptoms. And of course, things like DBT and group therapy potentially antipsychotics are all ways to kind of intervene and help better these psychotic symptoms or psychotic episodes. There's unfortunately not one cure-all way, method, or technique to absolutely eradicate these symptoms entirely, but there's ways to lessen the symptom and impact it has on you by also recognizing these symptoms when they show up in you, so that way you can intervene early so it doesn't get to a point of kind of no return. I know what it's like to be so disillusioned and be deep into psychosis, and I just want to let you know that you're not alone, and especially when you reach the other side of it, it can be quite disillusioning and unsettling. But again, you're not alone in these experiences. There's people like me out there who do go through this as well, and we'll get through this together.